Here's another patient that came to the dental office, and her main concern again was this kind of gummy smile, and the fact that her front teeth don't meet when she chews or bites together. The front teeth there's a space between them. So let's have a look at a close-up of those teeth. Here we see the space between her front teeth, and there we see a lot of gum tissue when she smiled. And here's the same patient again. So she went for a review, and what she was told was that the only way that she could be helped was to have surgery done on her top jaw and on her bottom jaw. So she wasn't very keen on that idea, and so she started to research and find out, is there any alternatives that could be used instead of using a surgical option? So we said, well, let's try a DNA appliance and see what happens. And so she starts wearing the top appliance, and this is after about 2 months of treatment. And what we can see is after 2 or 3 months that the top jaw has been remodeled. The bone has started to change. It's got a little bit wider, and that gummy smile has started to be reduced. Now, what we see is the space between the teeth is still there, so treatment's not finished. She now needs to go to a bottom appliance, a lower appliance, to make sure that both the top jaw and the bottom jaw are coordinated. And that whole procedure took about 14 months, close to 14 months. But what you can see at the end is the gummy smile has gone away, the bone's been reshaped and remodeled, and the open bite that she had has been also reduced. And in this case, we used final brackets, orthodontic brackets at the end. We used just to make sure we've got a lot of coupling of these top teeth to the bottom teeth, just to make sure that the whole result is stable. So in this case, she was finished off using brackets, but the amount of bracket use was very minimal at the end, just to get to that final detailing. But look at the changes that happened. So all of this was achieved with a DNA appliance. Look at her nostril on her left side here, the right side in the picture. It's pretty much blocked, it's closed, which means she was opening her mouth to breathe, which is probably why she got this gummy smile and this open bite. And then by widening her upper arch, her top jaw, using the DNA appliance, you can see that her nostril here is symmetrical, so now she can breathe through her nose more easily. That allows her to keep her lips together, and after about 14 months, combination, mostly DNA, a little bit of detailing with the orthodontic brackets at the end, and she has a nice-looking smile, no gummy smile, and no anterior open bite, and she's breathing and sleeping really well. So what do we say? How do you describe this in terms of scientific words? Well, this is a correlation between the form and the function. The form is the shape and the size of the jaws, and the function that we mentioned, breathing through the nose, sleeping well, swallowing with the tongue going back. So all of this supports the idea of craniofacial homeostasis, that this whole craniofacial region has reached a new level of equilibrium, a new level of harmony, and it looks nicer and it works better.